Hello, I'm Natasha. I'm a caveat here. I'm a registered dietitian by background. I work in the care team at Diabetes UK with other dietitians and nurses. So I've been invited, so thank you for inviting me. I've come here today to talk about diabetes technology and first aid. So in terms of what I will cover today, it's very much a very quick whistle-stop tour. I'll cover a brief overview of diabetes identification, an introduction to diabetes tech and its role in diabetes management, blood glucose targets, hypos and hyperglycemia, and the role of the ambulance crew and the future of diabetes technology. And I won't be able to cover everything today, but we've got a stand in the foyer you may have noticed, and also there's a wealth of information and videos and free resources that you can download from our website diabetes.org.uk. So I do urge you to look at that, and it's regularly updated. We have new content all the time. So in terms of what is diabetes? I'm sure many of you know, but just as a sort of a recap, diabetes is a serious condition where your blood glucose levels are too high because your pancreas either doesn't make any insulin, or the insulin it produced is not working effectively, or you're not producing enough. And there are two main types of diabetes, type 1 and type 2 diabetes. Now with type 1 diabetes, it's an autoimmune condition where your pancreas shuts down completely and you don't produce any insulin. And with type 2 diabetes, the pancreas may be producing some insulin, or the insulin is not very effective. And if left untreated, high sugar levels can cause serious health problems and long-term complications of diabetes. So the symptoms of undiagnosed diabetes, and you may be wondering why I'm sort of covering this, but the fact is the prevalence of diabetes is very high, and the prevalence of diabetes is increasing all the time in the UK. There's actually over 5 million people in UK with diabetes, and I'm sure amongst you there's maybe some of you that have got diabetes. And we do know with type 2 diabetes, because the symptoms may go unnoticed, people could be living with the condition up to 10 years before it's diagnosed. And we know there's at least 850,000 people in the UK with type 2 diabetes that don't know it. So you may be coming across a casualty that actually has type 2 diabetes that is not aware of it. Also, type 1 diabetes, because your pancreas shuts down completely, the symptoms are very noticeable, but we still unfortunately have many cases still in the UK where type 1 diabetes is not picked up quickly enough, and this was happening in the case during the pandemic, for example, and people are dying unnecessarily. So it's just to make you aware of this. So the symptoms, they do vary from individual to individual, but there are 4 common symptoms, and we call them the 4 T's. That's going to the toilet, thirsty, tired and thinner. Now, because if your body's not releasing the insulin, or the insulin is not very effective, or you're not got enough insulin, the sugar can't come out of your blood cells, out of your blood into your cells, be used for energy. So people are losing weight because the body was breaking down fat to try and get some energy. You're feeling thirsty because of the high sugar levels, so you're drinking a lot. And because you're drinking a lot, you're going to the toilet a lot. And because you can't get that energy into your blood cells, you're feeling very, very tired. So that's just a recap of the 4 main symptoms of diabetes. Again, as I mentioned, type 1 diabetes, people notice those symptoms, whereas type 2 diabetes, if you think about it, I'm sure all of you feel tired at the moment. You know, to me, a lot of people aren't aware that they've got type 2 diabetes unless they go for a routine blood check or they go into hospital for another reason. So, in terms of diabetes identification, there's different types of identification. So the casualty that you may come across, they may be wearing a necklace, they may have a card in their wallet, they may be wearing one of the different bracelets, and we sell a lot of these different bracelets on our shop. Etsy, for example, Amazon have lots of different ID at the moment. So the days of when you used to have a sort of traditional necklace are long gone. People may have different forms of identification. Other clues that could indicate that a person has diabetes, they may be wearing a hybrid closed loop, which I will talk about. They may be having a continuous glucose monitor on their body. They may be carrying diabetes medication. And they may have the traditional blood glucose monitoring, which is on the bottom left there. They also may have some hypo treatment on them. So, for example, the lift or the glucose tablet. So these are things that can alert you to the casualty that you come across or the person that you're treating in the workplace that has diabetes. So in terms of diabetes technology to look for, this type of technology is a lot more common now. Certainly with type 1 diabetes, I'm pleased to say in terms of NICE criteria, it means that people with type 1 diabetes are eligible for this kind of tech. Many people with type 2 diabetes self-fund as well. And it's important to stress, never remove the technology that the person's wearing. The ambulance crew, in terms of their ambulance guidance, they're told not to remove the diabetes tech as well. But really work with the casualty, ask the person what they would like to do. This may include scanning their Libra, and I've come to this patch here, this Libra, that actually, if you scan it with a phone, it will actually tell you the blood sugar levels of that person, but you'll need a passcode. So really, I've been talking to the nurses in my team who, help out on many of our diabetes camps. It's really the person with diabetes is the expert. So really work with them if you can. Appreciate they may not be conscious, but really work with them what they would like you to do. And again, we've got at the top there, that person's wearing a pump, and then there are the glucose monitors on the bottom, and then there's another type of pump on the far left. But I'll cover this in detail throughout this session. And again, we've got so much information on our website, some fantastic videos that have been produced with people living with diabetes. So a continuous glucose monitor, it measures the glucose in your interstitial fluid, so every 5 minutes. So you get a continuous idea in terms of what a person's blood sugar levels are. And the person downloads their data, and the data can be looked at in various ways. So people can look at the time spent in range. In the old days, in terms of blood glucose monitoring, you used to do a finger prick test, and you just got the blood glucose levels at that moment in time. So if you did it 3 times a day, you may think you've got fine blood glucose levels, whereas with the continuous glucose monitoring, you actually look at exactly what's going on throughout the day, and it gives a clearer picture. So you can see on the left-hand side, sorry, on the right-hand side, a traditional old-school blood glucose monitoring machine. It shows a person would think they were fine, but actually the continuous blood glucose monitor will show the peaks and the troughs. So you get a better picture, you get an idea in terms of how much time in range that you're spending. And so it really helps people monitor their blood sugar levels a lot more effectively, and it's useful for managing day to day. It's important to stress the technology, the glucose CGM and the glucose continuous glucose monitoring lags behind the blood glucose testing. So even though someone will be maybe wearing this tech, it is important to actually use the blood glucose monitoring system if you're trained to do so and you're competent to do so. And encourage the casualty, to check their blood glucose monitor, using their blood glucose monitor in a casualty situation. Many people using tech will still be carrying, are likely to still be carrying an old school blood glucose monitor. So do encourage them to use it, because the results can lag, especially in times of exercise and in eating. So it's important to get a clearer picture that you encourage the casualty to check their blood sugar levels, or if you're competent to do so yourself. So what are these glucose monitors? What do they look like? So as I've mentioned, you've got the Freestyle Libra there, and they're very common really, and most people with type 1 diabetes will be using that. And I'm sure you've probably noted Theresa May, she's got type 1 diabetes, she wears a Libra, you can see on the back of her arm, and various other people. Amelia Lilly, for example, the celebrity, the younger people in the group, she has one of these CGMs. They sit just under the skin, and they read, as I've mentioned, the interstitial fluid every 5 minutes. And as I mentioned, they can lag behind blood glucose measurements. So can't stress enough, it's important to work with the casualty to check their blood glucose levels using an old school meter, because it especially can. If someone's doing something like exercise or eating, which rapidly changes their blood sugar levels, it won't give you an accurate picture. And they're usually sited in the back of the upper arm or the stomach, depending on the type. So they will look like this. You can also get some fancy patch covers. The one in the middle actually is a patch cover for a pump, so apologies, but people may be, especially the children, may be wearing dinosaur patches over their covers. They won't be white, for example, or you've got a unicorn patch. Etsy, I was looking the other day, you can get a whole host of different varieties. So if you see those, that's likely to be a kind of diabetes tech. So they're not necessarily just going to be white. I think Theresa May just wore white, didn't she? But, nowadays, certainly in our offices at Diabetes UK, we've got, a high prevalence of people living with diabetes have different colours patches. So the old school blood sugar monitoring, which I'm sure probably talking to all you amongst you, you're aware of this, blood glucose equipment should only be used if you're competent to do so. The ambulance crews will carry their own blood glucose meter, but again, as I've mentioned, it's likely the person living with diabetes will have it with them. Encourage them to use it. Make sure the skin's clean using non-alcohol wipes or cotton wool and water, and make sure it's dried before testing. But do check what you're allowed to do within your own scope of work. Don't do any testing if you're not competent to do so. So, work with the person, check if they've got a blood glucose monitor, and check their blood sugar levels if you're competent to do so, because this is all information that the ambulance crew would find really, really helpful. So in terms of the target range, in terms of blood sugar levels, target range for people with type 1 and type 2 diabetes are generally between 4 and 7. Too low is under 4 when you're having a hypo, or high is over 7. Now, trauma and illness is likely to increase blood sugar levels, and it's worth asking the person living with diabetes what their blood sugar level management is usually like, because then you get a clearer picture of what's going on. And in terms of a healthy range, the HbA1c target, which is different to on-the-spot blood sugar level measurements, an HbA1c target is the average blood sugar levels over the last 3 months. It's the sugar that's stuck to the haemoglobin in the red part of the blood cells. A healthy target range is about 48 millimole/mole. And tight, good control of blood sugar levels is so important to reduce the long-term complications of diabetes, as well as the short-term complications of diabetes, the hypos and the hyperglycemia. And again, we've got lots of information on our website. So insulin pumps, when I trained back in the dark ages in the 90s, insulin pumps were very, very rare. People were using insulin pens. Now, insulin pumps have revolutionised the management of diabetes, and it's a small electronic device that releases insulin throughout the day. With pens, you can really only just inject units of insulin, whereas an insulin pump, you can do a fraction of a unit, so very, very tiny amounts. And it's fast-acting insulin only, but it allows a person living with diabetes to have much improved control. There's 2 types of pumps, tethered or patch, which I'll come on to. And it's usually only available for people with type 1 diabetes, but many people nowadays do have the pumps. And it's important to stress, type 1 diabetes, yes, it's diagnosed generally, in the younger age group, but people living with the actual increase of the age of type 1 diabetes, adults, post 40, are still diagnosed with type 1. In fact, people up to the 90s I'm aware of, diagnosed with type 1 diabetes. And people die with type 1 diabetes, like all of us, get older. So there's still that myth, if you see someone who's 65, that they're going to have type 2 diabetes. Well, they may well have type 1 diabetes, so it's important to be aware of that, because there's sometimes that myth comes through and we get calls about this. So pumps are very popular, and they, in terms of, they have an inbuilt bolus calculator. So you can, if you've eaten some carbohydrate, for example, you can tell your insulin pump what amount of insulin to give. And it also you can program to do an insulin suspend if you notice your blood sugar levels are falling too low. So it really has revolutionised blood glucose management. So in terms of the 2 different types of pump, we've got here a tethered pump and a patch pump. So I don't know if any of you have sort of been trained in diabetes over the years. They've got a lot smaller, they've got quite a large pump there, but the patch pump, I've been on maternity leave, I've had 3 lots of maternity leave, it's just changing all the time and things are getting smaller and smaller. So do urge you, I can't stress enough to keep looking at our website, things do change. So a tethered pump, which as you can see with the tubing, is attached to the body by another small tube that connects to a cannula. And the pump itself usually all has the controls on it, and it can be carried on a belt, in a pocket, in a body band. It can be worn under clothes too. So I know you've got sort of mountaineering sort of session covered. You may find some people, like they're going skiing, for example, they wrap it up in socks as well. So, work with the casualty to try and ask them where it is. And tethered pumps can be different in things like colour, screen size, and some have extra features like Bluetooth remotes. You attach patch pumps directly to your body where you've chosen to place your cannula, and people tend to put them on their legs, arms or stomach. Now with the patch pump, it has no extra tubing, which means the pump sits directly on your skin and it works by using a remote. So they deliver insulin, and they sometimes get confused with sensors because they do look similar, but they are, if you study this, they do look, they are different and do look different. They deliver insulin, and they have a different function measuring glucose. And like a tethered pump, patch pumps are disposable, so they have a different function measuring glucose. And you'll need to change the whole device. The person with diabetes needs to change the whole device when their pump alerts them, not just the infusion set and location. And as I mentioned, patch pumps may be covered in an extra decorative patch, so that's important to be aware of that. They're not necessarily going to be looking like the white that you've got this on the person's back. And do ask about the tech that person's wearing if they're conscious and able to. So again, we've got some information again on our website. And as I mentioned, the pump there is quite large. And yet, I know my old care manager, he used to wear very, very small pumps. They have got smaller in size. And when I first trained, you didn't get these patch pumps at all. And they've really made life, you can think, people so much easier, so less cumbersome. So in terms of other tech available, there's a hybrid closed loop. Now, a hybrid closed loop system, and this will look like this here. And this is where the sensor talks to the pump, and the pump automatically adjusts the insulin, which is fantastic. You may have heard it called an artificial pancreas. So it detects if a person is going too low, and it actually suspends the insulin, or if the sensor detects if a person's blood glucose level is likely to rise above target. It temporarily increase the basal rate, the amount it's administering, or deliver a small corrective bolus. So if your person's blood sugar levels are higher than they should be, because the person will have set the target range they'd like their blood sugar levels to be, it would actually administer a bolus to correct that high blood sugar levels, or a combination of both. And this is because it works on an algorithm that is within the pump. So you can see, the fact it's talking to each other what a person's blood sugar levels are. It's just really, so amazing. Really, this is in terms of NICE criteria. People with type 1 diabetes, if they fulfil certain criteria, are eligible for hybrid closed loops. And the pilot sites for the last few years, which Diabetes UK have been funding, have really shown the benefit of these, because they really help people, quality of life, improve people's long-term management of HbA1c, and also help improve their time in range. It can be useful to ask a person if they're wearing a hybrid closed loop, and also ask them if it's in exercise mode, because if a person is carrying out any activity, they may have put it into exercise mode, so where their target blood sugar levels are higher, so less insulin is administered. So they're going out, they know they're going to embark on vigorous activity, they may set it in exercise mode, so as a sort of erring on the side of caution, so it's not, their body's not really, they're not giving too much insulin, so they're increasing their risk of a hypo. Also asked, does it suspend insulin when hypo? And these are things to help the person with diabetes consider about their management while waiting for an ambulance. But of course it depends on the cognitive function and the conscious level of the person that you're dealing with. So just be aware, there's such a range of different tech. You've got the sensors, you've got the base, the tether, the patch pumps, and also hybrid closed loops, which you're going to be seeing more and more of, because in terms of the guidance, people are eligible for this technology. So in batteries and chargers, this is important to mention, and one of the she's not a healthcare professional, but one of the public health policy persons in our team. She's a St John's ambulance trainer. She helped with the marathon pump, and she because obviously with her job, she knew a lot about diabetes, and I know she helped out someone, battery went low, so she was able to lend them her power bank. So in terms of the battery life can vary from one pump to another, but you can expect to need to change the battery anywhere between a few times a year to once every 2 to 3 weeks. So, and living with diabetes, I can't stress enough, I'm only covering the tech, is relentless. There's so much people have to think about. They have to count their carbohydrate for type 1 diabetes, for example, have to tell, the hybrid closed loop, there's a lot you still need to do. You have to tell the pump how much carbohydrate you've eaten, so it can work out, the calculation to do. There's the monitoring, there's the appointments, there's so much to think about. So think of yourself in terms of like making sure your phones, you've got enough power. It is possible that some people, in terms of their pump, don't have, or sensor, they've run out of charge. So in terms of the mobile device, it will shut down due to a low battery, and your person won't get any alerts. So there is a battery icon on the reader which will indicate battery life, and I appreciate some people may, if they're stuck up in a mountain for a day or so, there may be a sort of reality situation that they have run out of charge. So carrying a power bank will be helpful in terms of your person, so you can charge the battery and offer the person a charger. So flash receivers on mobile phones acting as a receiver need to be adequately powered to read the sensor, and that is important. So in terms of low blood glucose levels, hypoglycemia, this happens, it may be in terms of a person hasn't eaten enough carbohydrate, and a person may feel disorientated, sweating, being anxious or irritable, going pale, palpitations and a fast pulse, lips feeling tingly, blurred vision, and again, something that may alert you to the person having a hypo is if they're carrying diabetes IT. And if you're managing to, if you're trying to maintain your blood sugar levels within a tight range, that's very, very difficult. And people may find sometimes their blood sugar levels go too low because they're trying to maintain their blood sugar levels in such that tight range. So hypos are very common, no matter how great a person's blood sugar level control is. So this is a very, very common occurrence. So in terms of a treatment, if conscious, a person needs to eat or drink 10 to 15 grams of 15 to 20 grams of fast-acting carbohydrate, such as 5 glucose tablets or dextrose tablets, 4 jelly babies, a small glass of sugary drink, a small carton of fruit juice, 2 tubes of a glucose gel like glucogel or rapizo gel, or glucose juice like lift drink shots. And it's important to test after 10-15 minutes, because if the blood sugar levels are still less than 4, then you should again have repeat this and give more fast-acting carbohydrate, the 15 to 20 grams, and test again after a further 10 minutes. And someone, if they're treating their hypos with this rapid-acting carbohydrate, they may need to eat afterwards something slow-acting like a slice of toast or a bowl of cereal. And if the ambulance crew is supporting someone with a hypo, they will wait until the person has fully recovered before leaving them. So again, I'm sure probably you've come across people experiencing a hypo, or if you work with someone with diabetes, it's not unfortunately a rare occurrence. It does happen. People may not lose access to their usual carbohydrate, for example, stuck in an emergency situation, so their blood sugars go too low. May have administered too much insulin, for example, my mistake, and their blood sugars are falling, and they've gone too low. So again, it's important to be alert to this. And these are just some examples, pictorial examples of hypo treatment. So you've got the jelly babies, which are popular amongst children, the lift juice drinks, and the fruit juice. Now, severe hypo, that's when a person becomes unconscious, no food or drink, recovery position, which I'm sure you're probably aware. And glucagon injection, if you know how to do it. Glucagon, basically, it means that if you inject it, the liver will release the glucose, so raising the blood glucose levels. And certainly call an ambulance if you don't have a glucagon injection, or no recovery 10 minutes after the glucagon injection. So again, we've got information on our website about that. Basically, hepatic glucose release, it causes your liver to sort of release the glucose into the person's bloodstream. Now, hyperglycemia, that's when blood sugar levels go too high. And as I've mentioned, stress or illness can cause high blood sugar levels. So several reasons for this maybe include missing a dose of medication, eating more carbohydrate than a person can cope with, or maybe it's just something they're just not aware of, or maybe unwell that they're not realising, and trauma can raise a person's blood glucose levels. And symptoms of hyperglycemia, the blurred vision, the rapid pulse and breathing, the fruity sweet breath, and the drowsiness, they may become unnoticed, and they may not notice until their blood sugar levels are very high, and at which point action needs to be taken. So in terms of action that needs to be taken, people will need to check their their ketones if they've got a ketone meter, and encourage them, ask them if they're carrying a ketone meter, which is different to a blood glucose monitor meter, and encourage them to test if their blood sugar levels are above 14, or if they're just feeling generally unwell. It's always a good idea to check ketones. But again, don't do anything you're not competent to do. And certainly encourage the person with type 1 diabetes as a casualty to test for ketones. Ketones above 1.5 will usually need treatment with insulin to bring down your blood sugar levels. And the person with diabetes will generally need to do this themselves. Ketones above 3 need an assessment for diabetic ketoacidosis. Now, diabetic ketoacidosis is when, as I mentioned, when your blood sugar levels go so high and you've developed ketones in your blood, and ketones are acidic chemicals which are dangerous, and DKA is a potentially fatal condition. So it's so important that if you are getting to the situation where the ketones are above 3, they need an assessment for DKA in hospital. So they would call an ambulance. They need to be transported to hospital. And certainly above 6, they need urgent admission to hospital for an assessment of DKA. So again, above 1.5, encourage the person to administer insulin to help bring their blood sugar levels down, and certainly above 3, above 6, they need to get to hospital definitely, because it is a potentially fatal condition, diabetic ketoacidosis. So if you suspect hyperglycemia, high blood sugar levels, or if they're unconscious or cognitively impaired, or hyper, they need urgent treatment, call 999 or 112. And you've got such an important role, say you suspect this. While you wait, keep checking the person's breathing, pulse, and whether they respond to you. And if they become responsive at any point, open their airway, check their breathing, and prepare to start CPR. Now, in terms of insulin pens, probably all come across these. In situations of hyperglycemia where a pump has been dislodged, and that does happen, encourage the person to think about insulin correction doses, using their insulin pen, not their pump. Everyone with a pump are encouraged, it's good practice to carry an insulin pump in case of a pump failure. So do ask about this, because that could be used. You can encourage the person to use the insulin pen, obviously depending on their blood sugar levels, as appropriate. And again, the person with diabetes is their expert, but I'm aware in the sort of emergency situation, they may not be thinking straight. So your role is to really sort of support them and help with that thought processes. So what were the ambulance crew? And I was
Natasha, I was just conscious
time.
of time.
All right, sorry.
I'm not there, so I can give you that kind of 5-minute warning.
Okay.
So if we can kind of just give you a couple more minutes, then we'll wrap up.
Yeah, we'll do. So apologies. Okay, so they'll do their usual assessments A, B, C, D, and E, and they will check their blood sugar levels to rule out hypo or hyperglycemia. They may well, depending on the area, carry a ketone monitoring. They will carry glucagon for treating hypos. They won't remove any diabetes tech, it's not in their guidance, and they will decide if a person needs further assessment in hospital. And the last slide, future of diabetes technology may well be automatic hybrid closed loops, because as I mentioned, still a person with diabetes has to enter the amount of carbohydrate they're eating. Multi-hormone closed loop systems that can deliver glucagon as well as insulin, and continuous ketone monitoring as well. So it's very exciting, it's rapidly changing in the diabetes world. Safety tips, just a quick recap: don't remove any equipment, test blood sugar levels. Mostly this be encouraging the person to do this. As I stressed, in an emergency situation, don't rely on the tech because it lags behind. Use the old school blood glucose monitoring. Treat all hypos immediately. Encourage a person with type 1 diabetes to test for ketones if equipment's available. Work with the person with diabetes, possibly with insulin injections if their pump has come off, the pens I've mentioned. Be aware that extreme temperature, cold or hot, can affect equipment, testing strips for example. Tell the ambulance crew what tech they have, where it is sited, and anything that you or the person has done while it's waiting. Remember, the casualty may not remember all that you've done, so take notes and be as accurate as possible. You've played such a vital, important role, and people may need food, obviously, if they're conscious, to be able to eat it. And thank you very much. Thank you.